Common integumentary disorders and diseases. First is the skin. What does it do? It provides protection against diseases, disorders, bacteria, and viruses, as long as the skin is intact. The skin protects us from ultraviolet rays and works with the body to regulate the body's temperature. Acne is a chronic inflammatory skin disorder that occurs primarily on the face, neck, chest, back, shoulders, and upper arms. Acne can be caused by overactive oil glands that produce too much oil and plug pores of the skin. Acne can be caused by genetics, hormones, menstruation, stress, and some medications. So, how do we treat acne? Acne medications work by reducing oil production and swelling or by treating bacterial infection. So these are the examples of acne medications. First is topical medications. It is composed of retinoids and retinoid-like drugs used for removing dead skin cells to prevent them from entering hair follicles. Antibiotics used for killing the bacteria. Azelaic acid is used for an alternative for retinoid-like drugs if they are itchy or painful. Also, salicylic acid is used and dapsone. So next we have oral medications. Oral antibiotics is used for mild and severe acne. Combined oral contraceptives, anti-androgen agents is used for blocking androgen hormones, and isotretinoin is used when the acne is not responding to other treatments. And lastly, we have therapies. Chemical peel uses repeated applications of chemical solutions such as retinoic acid and salicylic acid. Next is drainage and extraction. So, a doctor may use tools and equipments to gently remove the acne. Last is steroid injection. Uses steroids which results to rapid improvement and decreased pain. Next, we have burns. Are tissue damage that results from heat, overexposure to the sun or other radiation, chemical or electrical contact. Burns can be minor medical problems or life-threatening emergencies. The treatment of burns depends on the location and severity of the damage. So, how to treat burns? Most minor burns can be treated at home. They usually heal within a couple of weeks. For serious burns, on the other hand, after appropriate first aid and wound assessment, your treatment may involve medications, wound dressings, therapy, and surgery. The goals of treatment are to control pain, remove dead tissue, prevent infection, reduce scarring risk, and regain function. People with severe burns may require treatment at specialized burn centers. They may need skin grafts to cover large wounds, and they may need emotional support and months to follow-up care such as physical therapy. These are the examples of medical treatment for burns. First is the water-based treatments. Your care team may use techniques such as ultrasound mist therapy to clean and stimulate the wound tissue. Next is fluids to prevent dehydration. You may need intravenous IV fluids to prevent dehydration and organ failure. Last is pain and anxiety medications. Healing burns can be incredibly painful. You may need morphine and anti-anxiety medications, particularly for dressing changes. Now, let's proceed to dermatitis. Dermatitis is a general term for skin inflammation. With dermatitis, your skin will typically look dry, swollen, and red. Depending on the type of dermatitis you have, causes vary. However, it's not contagious. So now we have the at-home and medical treatment options for dermatitis. Treatments for dermatitis depend on the type, severity of symptoms, and cause. Your skin may clear up on its own after 1 to 3 weeks. Medications to reduce allergies and itching, like an antihistamine such as diphenhydramine or Benadryl. Next is phototherapy, or exposing affected areas to controlled amounts of light. Also, topical creams with a steroid like hydrocortisone to relieve itchiness and inflammation, creams or lotions for dry skin, and lastly, oatmeal baths to relieve itching. The next part of the integumentary system is the nails. The fingernail is an important structure made of keratin. The fingernail generally serves two purposes. It serves as a protective plate and enhances sensation of the fingertip. The first nail disorder we have is the green nail syndrome. It is an infection of the nails that leads to a greenish discoloration of nails, also known as chloronychia. It is caused by a bacteria called Pseudomonas aeruginosa. This bacterium flourishes in wet environments such as jacuzzis, contact lens solution, sinks, and bath sponges. The question is, how do we treat green nail syndrome? Fortunately, it responds well to treatment. Therapy consists of cutting the detached portion of the nail, keeping nails dry, and avoiding trauma to the area. Topical antibiotics such as bacitracin or polymyxin B applied 2 to 4 months per day will cure most patients if continued for 1 to 4 months. Alternatively, chlorine bleach diluted with 1 to 4 ratio with water is effective in suppressing growth of P. aeruginosa when applied topically to affected nails. Vinegar or acetic acid has been reported to be useful in this regard as well. The next nail disorder we have is the ingrown nail. An ingrown nail occurs when the skin on one or both sides of a nail grows over the edges of the nail, or when the nail itself grows into the skin. Redness, pain, and swelling, as we see in the picture on the right side at the corner of the nail, may result, and infection may soon follow. Sometimes, a small amount of pus can be seen draining from the area. So, how to treat ingrown nail? Ingrown toenails should be treated as soon as they are recognized. First step is to soak the foot in warm water 3 to 4 times daily. Next, keep the foot dry during the rest of the day. Wear comfortable shoes with adequate room for the toes. Consider wearing sandals until the condition clears up. Also, you may take ibuprofen or acetaminophen for pain relief. Lastly, if there is no improvement in 2 to 3 days or if the condition worsens, call your doctor. Also, another part of the integumentary system is the hair. It is an accessory organ of the skin made of columns of tightly packed dead keratinocytes found in most regions of the body. Hair helps to protect the body from UV radiation by preventing sunlight from striking the skin. Hair also insulates the body by trapping warm air around the skin. The first disorder we have for the hair is the common form of hair loss, androgenetic alopecia. This disorder, also known as male pattern or female pattern hair loss, results in permanent hair loss from the scalp. So, how do we treat androgenetic alopecia? Only 2 drugs currently have U.S. Food and Drug Administration or FDA approved indications for treatment of androgenetic alopecia. These are minoxidil and finasteride. First is minoxidil. The exact mechanism of action in hair growth is unclear. However, the proposed mechanisms of action are normalization of hair follicular structure, conversion of vellus hairs to terminal hairs, and amplification of the number of hair follicles in the anagen phase of hair growth. So, the second FDA-approved drug for the treatment of androgenetic alopecia is the finasteride. It is an inhibitor of the type 2 5-alpha reductase isoenzyme, which is predominant in the scalp, hair root, and sheath. By blocking 5-alpha reductase, finasteride inhibits the conversion of testosterone to DHT, also known as dihydrotestosterone. As discussed earlier, DHT can lead to hair loss in the scalp. Finasteride 1 mg has been found to reduce DHT levels in the scalp by over 60%. Another hair disorder we have is the alopecia areata. It is caused by the immune system attacking hair follicles. As a result, hair falls out in round patches from anywhere on the body. It typically grows back but may fall out again. So, how do we treat alopecia areata? Unfortunately, there is currently no cure for alopecia areata, although there are some forms of treatment that can be suggested by doctors to help hair regrow more quickly. The most common form of alopecia areata treatment is the cause of corticosteroids, powerful anti-inflammatory drugs that can suppress the immune system. These are the most commonly administered through local injections, topical ointment application, or orally. Lastly, we have the epidermis and dermis. The epidermis is the thin outer layer of the skin that is visible to the eye and works to provide protection to the body. It does not contain any blood vessels and is, therefore, dependent on the dermis, the layer of the skin underneath it, to provide access to the nutrients and dispose of waste. First is we have the basal cell carcinoma. It is a form of cancer that affects the mitotically active stem cells in the stratum basal of the epidermis. It is the most common of all cancers that occur in the United States and is frequently found on the head, neck, arms, and back, which are areas that are most susceptible to long-term sun exposure. How do we treat basal cell carcinoma? The goal of treatment for basal cell carcinoma is to remove the cancer completely. The first is surgery. Basal cell carcinoma is most often treated with surgery to remove all the cancer and some of the healthy tissues around it. Examples are surgical excision. In this procedure, your doctor cuts out the cancerous lesion and the surrounding margin of healthy skin. Mohs surgery. During Mohs surgery, your doctor removes the cancer layer by layer, examining each layer under the microscope until no abnormal cells remain. Lastly, we have the melanoma. A melanoma is a cancer characterized by the uncontrolled growth of melanocytes, the pigment-producing cells in the epidermis. Typically, a melanoma develops from a mole. It is the most fatal of all skin cancers, as it is highly metastatic and can be difficult to detect before it has spread to other organs. So, how do we treat melanoma? Types of surgery used to treat local and regional melanoma are wide excision, lymphatic mapping and sentinel lymph node biopsy, and lymph node dissection. First is the wide excision. The main treatment for melanoma is surgical removal or excision of the primary melanoma on the skin. A doctor removes the tumor, tissue found under the skin, and some surrounding healthy tissue called a margin so that no cancer cells remain. Next, we have the lymphatic mapping and sentinel lymph node biopsy. During this surgical procedure, the surgeon injects the area of the tumor with a dye and a radioactive tracer. This is to figure out which lymph nodes might be involved and whether the melanoma has spread to the lymph nodes. During these procedures, the surgeon removes one or more lymph nodes that take up the dye and or the radioactive tracer, called sentinel lymph nodes, to check for melanoma cells. Last, we have the treatment for melanoma is the lymph node dissection. If biopsy results show that cancer is found in the sentinel lymph nodes, this is called a positive sentinel lymph node. This means the disease has spread. In the past, the removal of more lymph nodes is called complete lymph node dissection, or CLND, was typically recommended. A patient will take longer to recover after CLND and have a higher risk of side effects. That's all. Thank you.